Hi, I am Dr. Prashant Chopra. I am the senior implantologist at Pune Dental Office. I've been in practice for last 26 years and I have seen a lot of curves going up and down in the field of dentistry. We've come a long way from analog dentistry to digital dentistry, which we are practicing here at Pune Dental Office. With the grace of God, we are one of the very few people who have the benefit of using an intraoral scanner from Trios 3Shape and the software to cultivate the crowns and the bridges and the veneers to get that perfect smile. Let me just take you back to a small walk of difference between the analog and the digital dentistry that's been prevailing in the market for that long. We've been working with the analog dentistry for years, and still 85% of doctors all around the world are still working with the analog dentistry. So what's the big difference between the two? In the analog dentistry that I've been working, let me just take an example of doing a restoration in the posterior segment, of doing an onlay, inlay, 3/4 crown or a full crown. Now, on a normal protocol of doing an analog dentistry, what changes? The preparation remains the same? Definitely yes, depending upon the type of material that you're going to use, you do your preps. Once you have done with your preps, you go ahead by recording some impressions. Now that could be a silicone, polysilicone. There are a lot of materials in the market that is available for you to utilize, and we've been using that too. The part comes of the problem is when you're using an analog dentistry, a lot of human errors are going to get incorporated at the time of your recording of the impressions. Now this could start as early as mixing of your putty by your assistant or by myself. Then the trays, you come on the impression trays, they're bulky, you got material in them, patient tends to get a little gagged up. Your pressure of placing the impressions over the teeth may or may not be so good. There could be some undercuts that can get in and so forth and so on. And once the impressions are done, you need to, before that, isolate your tooth. Now for isolation, retraction cords, a lot of other materials are available. My preferences nowadays, what I use is a paste which comes from the company called GC. It's a beautiful product. You do not have to push the retractions into the sulcus and damaging the periodontal ligaments. So here we are, we record, and then the thing comes of sending it to the laboratory. So we do the packages, we send it to the lab. The technician has to pour your impressions. Now the time that gets in between of you sending the product back to your lab, the distortions that happen in the materials definitely is going to come in. Now once that comes in, the technician pours. If the impression is not poured properly, it's re-poured again, shrinkage happens, and so forth and so on. Now it depends upon what skill has your technician has on his hand, whether he's a very skilled technician or he's a technician who you are paying a little less for, is the product that is going to come back to you. Now what issues come in here is the fixings. When we get it back, or at times even before that, the lab calls you in and says, "Doc, there is an undercut, there is the impression has not flown, your margins are not recorded properly, there is a debate going on and on and on." Now who's the sufferer? You got to come back to the patient again, you got to re-record the things again, send it back to the lab again, you waste a lot of time, you waste a lot of money on that. Not that something the patient is very happy to sitting back on the chair again and again to do so. Now, with the digital dentistry, what has really changed? Things have become more predictable, they have become more fast. We save a lot of time in recording and sending it to the laboratories. We can check the things much earlier, right at the time of recordings, as to anything has gone wrong, and just take few seconds to just modify them and record a new impression at the same time. You don't need bulky trays with the material to pop into the patient's mouth and cause him to gag over it. You just need a small intraoral scanner, and this scanner is from 3Shape. It's one of the best scanners you can think about. It's got a small head, it's got an accessibility where you can record all the way down to the distal aspect of your arches. It's very, very convenient. What you can record in this is something so meticulous, that the eye just cannot miss it. And you can see everything right here on the screen. This is one of the changeovers. This is the impression that one has recorded. This is a changeover into a cast. You can actually flip it up and you can see your margins right there. And if you feel some of the margins are not being recorded, you can actually just re-record by placing your retraction cord or your impression or your retraction paste down there, and you know that your margins are well taken care of. Now, this is a fantastic thing to use, and this just gives us a lot of predictability, less chair time, and the predictability that the crowns or the inlays or the onlays, whichever comes in from the lab, are so precise, because what we do here after the recording, the entire thing goes on to a digitalized software, again from 3Shape, that what we use here. We draft and we cultivate the entire designing over the software. Once that is done, the entire information is sent on to the milling machine. We do have a chairside milling machine here, and the whole production is done in a matter of an hour or so. So between the analog, which takes like 3 or 5 days from it to start and finish, here we can do a one-day dentistry where we can just scan and have a digital 3D models, and the designing of the crowns and everything done so precise that you can actually just tilt your model up and the crown just would not fall off. You can create and you can have a control on how much cementation you want into the software. So you can actually choose your luting cements the way you want to do it. So here we take a pride in saying that yes, we all need to move forward onto the digital dentistry to make sure that we have a beautiful practices going on and a learning curve which is never going to end. And thank you so much for this, and you guys are welcome to be with us and learn more. Thank you.